what is working right now in terms of mental health support in the communities that you live and serve?
Okay, I don't want to hog the mic, but I really love our community. When I said I'm looking around the room, JD mentioned earlier the sheriff, and we've worked personally challenging racism and know that there are programs happening to change outcomes, because that's really how we make a change. The county has invested funds and is making sure DHS is fully funded. Then I swing over here, and I know my sister Tiffany with the Marcus Alert. If you don't know what the Marcus Alert is, please look it up. We should all know. That allows 988 calls to be rerouted so that mental health individuals or professionals respond to the call with our emergency professionals, our first responders, to make sure that someone that is in a mental health crisis or that has a disability, that autism or might be non-speaking, that they have the right services. There are so many things happening here. There are SEL, social emotional learning lessons happening in our schools. I truly believe, and this is not a plug for Arlington, but it is, that we are really leading the way with a number of things and how they intersect to benefit the community.
I think we touched on it a little earlier, but we said that mental health is heavily stigmatized in the Latino community. However, in the Latino community, faith is very important. So something that I've seen is working is partnering with faith-based communities from different denominations and having their leaders encourage the congregation to seek services as well as guide them or have services done directly in the church if it's acceptable. Like, you know, I feel like partnering with faith-based organization is something that's really working right now.
I would like to share my experience working with our next-gen young folks. Rather than teaching directly about the mental wellness for the youth, we offer a lot of volunteering opportunity and cultural events to get together and build trust and confidence together. So after several months working on community services and a lot of experience a lot of cultural events, they feel confident to share their thoughts and struggles each other and get to know more about KCSC program, our organization's program, and easily connected with the mental health support or other opportunity to be educated on mental wellness. So that's our strategy working well now.
I definitely agree with the working with faith-based leaders. It's extremely important, especially if you know your community's faith-oriented, that to get the faith leaders on board with trying to have these conversations more directly in their congregations. I wasn't the one to design the program, but in our organization, we also do group therapy sessions, and what that looks like oftentimes is bringing people. So we have a hair braiders campaign, which is where we brought together African women that have a skill for hair braiding and help them with getting starting up a small business using that skill. And a part of that is that we have group just sessions to talk about whatever's been going on in their life. And we don't frame it necessarily as direct therapy, as direct mental health, but it's an opportunity to just talk about what's bothering them, impacting them, while in tandem having membership meetings where we do talk about mental health directly, and hopefully people kind of connect those dots and in their own lives. But I found that with cultures that are very, again, collectivist sessions like group therapy or being able to talk about it and see other people in your country or your community going through that experience is really powerful.